Hello and welcome back. Today, I want to talk about something that I have noticed in the past few years, especially with new grads. So, it's this growing belief that a clinician has to specialize in a specific part of PT right out of school. I get this sense from PT students that they feel the need to figure out the exact specialty they want to go in during their very first year of PT school. So it's one thing to try to figure out the patient population you want to work with while you're in school, and that's what clinicals are for. But it's another thing to believe that you need to pick a specialty as soon as you graduate. So, in this video, I'll be talking about why I think that is happening. I'll talk about the risks and the benefits to specializing versus being a generalist as a new grad PT. So, just so you know who I am Dr. Jody Miller, a physical therapist and a mentor to PT students and new grads. In the past 18 years, I've worked in just about every setting there is for PTs, from outpatient to acute care to director of rehab to a cash based clinic to academics and kind of everything in between. So, like I mentioned, in the past 5 or 6 years, I think I've noticed this pressure on PT students to become specialized as soon as possible. So, it's driven by this influencer era of healthcare that we're in right now. It comes from PT schools themselves, it comes from the belief that residency is best, and it comes a little bit from the APTA. So, students are asked early in PT school what specialty they want to focus on. New grads are asked right after graduation which specialty certification they plan to get. Students and clinicians are bombarded every day on social media by influencers who own businesses who say you have to niche down. They're bombarded by influencers who say that if you don't have a specialty, then you aren't the best person to treat those types of patients. We constantly hear from other clinicians and sometimes even our own professors that if you didn't do a residency or you didn't sit for a specialty exam, then you haven't learned all the information about that population or that diagnosis or that specialty. It creates this belief from students and new grads that if you aren't the pelvic PT or the ACL PT or the neuro PT guru on Instagram by your second year out of school, then you're already falling behind your peers. And I'm here to tell you that everything that I just said is absolutely false. It is not true. Okay. So let's talk about why this pressure exists, the risks that come with becoming a specialist early in your career, and the benefits to being a generalist. So let's start with why this pressure exists. So, like I said, it starts in PT school. So, students are asked early and often about what they want to specialize in. They get pressure from their professors and from the APTA to focus on a specialty as soon as they graduate from school. They get pressure to get more letters after their name by doing a residency and specializing in a specific population. They get pressure to get more letters after their name by sitting for a specialty exam within 2 years of graduation. They see it all the time from social media and the influencers that they look up to. And because they are constantly bombarded with all of this, students and new grads start to believe this idea that a specialty is required in order to be successful in this profession. New grads are taught to believe that a specialty will help them stand out in the job market, which means they're going to make more money. But that's not true for everybody. New grads are led to believe that having a specialty is flashy and fancy and really lucrative, and being a generalist is boring and you get paid less. This is not true. New grads are led to believe that by specializing in a certain population or a diagnosis is going to help them avoid all those mill PT clinics, and that's going to prevent them from burnout. This is definitely not true. Okay. All of this creates the idea that specializing is better because you can avoid mills, you can start your own cash based clinic, you can be better than everybody else, and you can make more money. And this is absolutely not true. Well intentioned people have promoted this idea of specializations, but somewhere along the way, it created this untrue narrative that specializing makes you a better clinician, which in turn has added this unnecessary pressure to students and new grads very early on in their careers. So let's talk about why that's a problem and why it can be risky to specialize too early. So, to start, it's a problem because the profession has now put added stress and pressure on students and new grads. Anytime pressure is added, burnout is going to follow. So, why do we want to push students and new grads toward more things, more work, more pressure by specializing right out of school? Why do we want to do that? Right? I say take your time. You don't have to specialize right after graduation. It's risky, and I will argue that it can dampen your career and your knowledge. And here's why. Specializing early creates tunnel vision. When you graduate, you are considered capable and safe of treating every person from the age of 0 to 100 with any type of diagnosis. You've just completed all your education, and all that information is very fresh in your mind. When you specialize, you start to get tunnel vision to the only type of patient or diagnosis that you want to treat, which significantly narrows who and what you are comfortable treating. This can close doors of opportunity. This can lead you to miss things like recognizing referred pain. This can result in you only working with this population for your entire career, and who knows what's going to happen in the future. Remember, humans are not just one system. We all have a musculoskeletal system and a nervous system and a cardiovascular system and a vestibular system and so on. When you specialize, you lose that ability to keep those systems interconnected. You forget that they all work together and you become less comfortable with those other systems. So instead of jumping into a residency or deciding right after graduation that you're going to specialize in a specific area, I want you to consider being a generalist for a little bit. I'm not saying don't specialize, but there's no need to do it right away. Okay. Give yourself some time to work with different people in different populations, in different diagnoses, in different settings. Give yourself the opportunity to truly figure out what you like to treat and who you like to treat. This allows you to strengthen all of your knowledge. This will help you become a more well rounded therapist. This will make you a better clinician because it's going to teach you to better recognize red flags. It's going to strengthen your ability to treat anyone that ends up on your schedule. It'll improve your ability to build rapport with people and communicate with different people. It'll give you a glimpse into what people go through at different stages of disease or injury. If you've worked in acute care, in a rehab setting, and outpatient, now you know where they are and have been or could possibly have been throughout through all of those stages. Okay, it will allow you to treat the whole person. It's no different than medical doctors, right? There are orthopedists and there's neurologists and there's cardiologists, but there's also primary care physicians and hospitalists who know a lot about the entire body. And sometimes it's these physicians who point the patients into the right direction for care. General PTs can do the same thing. We can treat the whole patient, or we can say, you know what? At this point, you need a specialist, and this is where I think you should go. I'm not telling you not to specialize or not to do a residency, but I am saying that you don't need to do it right after you've passed your boards or right after you've graduated. Give yourself some time to really figure out what you want to do. You will be much more well-rounded clinician. You'll be a stronger clinician in terms of clinical reasoning. You'll be able to help a lot more people by staying general in your first few years. Then, after you've figured out what you really like, that's when it's time to specialize. That's when you choose to specialize and then dive deeper into what really interests you and build on that strong generalist foundation that you've already built. Okay? Take it from me. I'm a generalist. I've worked in literally every setting throughout my 18 career. I love that I can do that because I have not specialized. I love that I can go from ortho to neuro to cardio to peds to geriatrics, right? I thrive on variety. I get bored if I'm treating the same diagnosis or the same type of patient day in and day out. I need variety throughout my day and throughout my week, and it keeps me on my toes. Okay, that's why I still work in the clinic 2 days a week. I have a cash-based clinic that I work in 2 days a week, and I treat gymnasts and I treat cheerleaders and I treat everyday people. And then the other 3 days a week, I'm tutoring and I'm mentoring. It's variety for me. Okay, it keeps me from burning out, and I think it might work for you too. I hope you shared a different perspective for you today, something you maybe hadn't heard of or hadn't thought of yet. And I hope you learned something new. Go ahead and drop in the comments your aha moment or something that really stood out for you, something new that you learned. Thank you. Thank you so much for watching. If you have any questions about what I talked about today, please feel free to message me or just drop your comments below. I will definitely come back. I'll read your comments. I'll answer any questions. All right. I will see you next time.